Uh, may I have your attention, please? A lot is happening actually all over the place, so I understand why everybody is not really there. But I love people who are here, so that's what really matters. Right? So let me introduce what this organization is all about and why is it there. So this is a sort of a combo or a collaboration between WAS and WIO. Wow. WIO, like WIO, right? So now, WAS, most of you know what it is all about. But in brief, again, I will tell you why the WAS was needed. Because once we understand the need for anything, everything else becomes easy, right? So the first and foremost need is that we feel that women are extremely competent. If don't call me feminist, I feel they have a lot more in them in many other qualities like resilience, working capacity, work hard, flexibility, kindness, compassion. Those are very, very women-like qualities which are highly useful in our kind of profession. But unfortunately, for lots of reasons, these qualities were not able to come out because there wasn't a platform from where they were supported. So instead of perceiving it as a platform for some kind of an activist kind of attitude, absolutely not. We are a pure support group. Oh, I'm Madhu Bhadoria, I'm President Boss. Right? So we are here to support each other. So really, it's a very, very equity, equality kind of a platform. So those who are there, who are equal to men, there's no problem at all. But those who have to reach there because they have the potential, for them we are here, right? So this is being done under multiple heads, like regular conferences that we have. We have research wing, WinR, we have rare eye diseases, we have mentor-mentee programs. Similarly, for each woman, the moment there is a need comes, kind of a program is devised. And the time is not far that probably women will outnumber. Right now, almost 50% women are ophthalmologists. And WIO has the same mission, vision, and shared values. So when the two organizations which have a similar mission, vision, and shared values, it becomes very easy to collaborate. And also that can provide you all a platform from where they can connect with us and we can connect with them. And truly, India, where it has reached now, we are at a reasonably high level. It is no longer that it was third world. It is not. You can see the convention center is so huge and everything is so big. So we are not third world anymore. We need to have pride. We do have lots of problems. Those problems we will take care of because we also have the grit and determination that whatever comes our way, we'll take care of it. So with that, I would say that we'll start the program. And ma'am is Dr. Aba Hussain. And ma'am has been a huge support for WIO and WAS both all the way along. Ma'am is president of APAO. So we are very honored to have her here. And she is a absolutely self-made woman. She had to go through lots and lots of things in her life, which were making her life very difficult. She fought them out, all kind of gender biases you can think of from the time she was a child. She just worked her way up by sheer, again, grit and determination. And see, I'm so happy to introduce her as President APAO. It's a great honor and privilege to have you here, ma'am.
Thank you so
and
very
about
much.
yourself, you have told before, and you know better than, but I know your life actually. I know what your journey has been. It's been a journey of lot of turbulence, lot of discrimination, but one thing she kept, a beautiful smile, calm, and that has seen her through. So all these programs are there. Some of you are here. Lots of you are not here. So this is also like now from here on, you will be messenger to the people who are not here as to what are the possibilities and why they should be connecting with WIO and WAS. All right?
Thank you.
Thank you so much. So with that, we'll start the program and Aarti will take over from here.
But I will definitely want some
I
words
think,
from Dr. Ava, ma'am.
Just a
And
minute.
I know.
I think WO has described.
Yeah.
Also, please
Yes.
keep in mind to say something about WOW.
Yes, ma'am.
Wow.
Very much. Yes. Wow. So this is one collaborated meeting of WOW and WOS, and I have very elite and very coveted speakers with us who will be representing WOW. WOW is Women Ophthalmology Worldwide, and the inspiration has come from the dignitaries on the dais. Dr. Ava ma'am has been a support for making us really go and cross boundaries and get women to have their conviction as professionals to walk up to the podium, to have the wings we've been spreading of WOS, to have that inclusive in WOW. And we have very interesting more collaboration going to in the way coming in with Dr. Timbu also with us, who's representing Orbis. And I must add one word, one very, very privileged honor for ma'am to say that I heard that it was 20 years we waited for ma'am to become, a woman to become the president of APAO. So I guess that
64
really,
years.
64 years.
64 years.
I think we know where we stand as gender. We do not talk about gender bias, but we just talk about our struggle, which makes us reach leadership positions. Ma'am, can I have some encouraging words from you?
Encouraging word, always I will do. Uh, Let us start the
Okay, let's start the
session.
program.
Then
I'll
in between I will say.
Sure. So I have with me Dr. Claire Sazlai Timbu, and I would introduce her as she's a technical advisor for gender and special projects, Orbis Canada. She's got a 15 years rich experience in public health, focusing on a lot of things and a lot to do with expertise in designing, managing, and implementing health programs across health development, emergency response, and hospital settings. So, very privileged to hear her having a strong background in gender equality. Very interesting to know about social inclusion and innovative health solutions. She has an experience in research as a close to her heart kind of scenario. And she's in advocacy, and she's great in fundraising and knowledge management for sustainable evidence-based programs. Skilled in training and facilitation, delivering workshops in diverse audience, and we heard her yesterday as well. So she has, she's rich in whatever she does. I would want her to speak on this topic, which is she's going to tell us a little bit more about redefining success in ophthalmology, women eye health leaders.
Arti, another moderator, Dr.
Yes.
Carmen Chan. Just after
Yeah, and
her, you
I-
introduce.
Sure.
And she will also moderate with you.
Very much. Can I have 3 sentences of your intro? I need to speak formally also. I'll read it out.
Maybe later. Maybe should we, without further ado, do you want to start the talk first? And then
Timbu, we can
Okay.
have you.
Okay. Thank you all so much for having me here. It's a pleasure to be in India again. I'm originally from Seattle, Washington, so it's a joy to be here with you this morning. Thank you for that kind introduction. I wanted to share that when I was growing up, my dad was a leadership coach, and he taught us from a very young age that everyone has the capability and unique qualities to be a leader. So when we talk about
You have another
redefining
program?
success in ophthalmology, where I come from is this idea that we all have the opportunities to be a leader in our own ways, and we all get to show up in the way that we do that
We have
every day.
lunch on Monday.
So even when I was a little kid, I would show up in a different way than my brothers, but I always felt inherently that as a leader I could make change with different groups I was working with or even within my own home. So that's sort of the foundation of what I believe in. And I also
Which
look
is the
around
first
and
speaker?
see leaders across this whole hall. So I just want to frame where we're at right now with gender equity when it comes to women who provide healthcare, right? We know this is a common phrase that women deliver health across the globe, but men are still leading it. And this is a paradigm that must change. There's also unique challenges that impact females versus males in the work setting. So workplace violence is very common. There's higher attrition rates when women choose to have a family versus their male colleagues. And then we also know that there's different types of barriers when it comes to retention, and trying to figure out exactly how to support female eye health professionals looks different than when you just do it for everyone. Specifically in ophthalmology, we know that women are on the rise in terms of our numbers of trainees, but we are still seeing the underrepresentation of women in leadership roles. We also see that there's still a pay gap in many settings between female and male ophthalmologists, as well as disparities in leadership when it comes to society, executive leadership roles, as well as in the academic world. So I am so pleased to share that due to these unique barriers, a group of women a number of years ago came together to talk a little bit about what do we need to do in response to the COVID-19 pandemic. So what started out as virtual meetings has now grown to become a movement, and I'm excited to share more about Women Leaders in Eye Health, which is a collaboration between Orbis International, Women in Ophthalmology, and SEVA Foundation, and hopefully more to join too. So Women Leaders in Eye Health is a pioneering collective initiative that seeks to uplift women at every level in the eye care space. We're doing this through transformative leadership, support with mentorship, strengthening our global networks, and helping to really break down those barriers that I just talked about and find the solutions collectively on how to address them. And we're doing this because when we help women, we help everyone, right? We're promoting equitable and inclusive care for all. So at this moment, we are global in our initiative. We have incredible networks across all of our regions, and we are really looking to deepen how that support can flow to different parts of the world and in different countries as well. We have 4 core work streams that we're involved with right now. The first is around conference sponsorship. So we actually provide grants for women to go to different conferences in the world and present their own research or show up as panelists. And then we're also looking to ensure that they have platforms to share thought leadership and their own expertise. The second work stream is around what we call coffee hours, which are informal events that allow women to share and build connections with one another. We do this virtually as well as in person, and we're looking to build out this community engagement space. The third part is around training, so building out more resources when it comes to gender equity so that you all have the tools to go to your workplaces and share them with your colleagues and make change there. And last but not least is kind of focusing on how can we include gender within our own organizations as well as with our partner institutions and strengthen from the inside out and lead by example. So I'm really happy to share that in 2024 was a huge evolution, and we were able to do quite a number of exciting things for the first time. We were able to provide our Cash Assistant Awards. We hosted 6 coffee hours at some major conferences. We also completed a training survey to look at the unique topics that our different country offices asked for when it comes to providing training support in the future. We were so pleased to launch our Women Leaders in Eye Health Advisory Council, which Madame is part of, which is such an honor. And now we're looking to deepen our research efforts as well and looking at a survey that I'll talk about in a moment to really understand how can we provide solutions to the challenges that women face. I just want to share a quick example of Dr. Benegas, who's from Honduras, who was able to go to a conference last year. And it really transformed her career. It really showed that she can produce her own research, she can be seen in different spaces as a leader, and bring that knowledge that she has from gaining that experience back home and integrate that directly into the work she does every day. So there's many ways to join and get involved with Women Leaders in Eye Health. We're so happy to have everyone who's interested reach out and be in touch. These are just some of the ideas that we have for the general public, but there's probably more ways that we can collaborate. The first also was a research survey that we are doing right now that we want to collect as many responses from you and your colleagues around the barriers and the solutions that are needed to support women to thrive in leadership. So last but not least, I'm so grateful to be here with you all. Thank you for your time. And this is another QR code to have you join our e-newsletter to stay in touch. Thank you so much.
Comments? Dr. Madhu, any comments?
No, she's actually opened she opened actually a new avenue which can be truly utilized by WAS members. And also she's showed us this thing QR code for a survey. So those who have not taken a survey can take a survey. See, Orbis as an organization is an international organization, and gender equity is part of their things, other than doing child programs and the flying hospital that they had. So we are doing a child program with them, but gender equity is a very important area of sensitivity. Mr. Hudke had also come here. He came to our hospital actually. So with that, in this thing that they're very aligned to. So through WAS, you can connect with Timbu. And if there are any areas where you can be helped, so say to attend a leadership conference, or maybe you present something leadership conference, or some gender equity ideas which are inclusive, it's open for. Am I okay?
Yes, thank
I'm offering on your behalf.
you. I appreciate it so much.
Great. So as we move on, I want to introduce Professor Carmen Chan. And it's a privilege to have her on this side of the podium. She's our moderator panel and a very, very well-placed, she's the secretary of Ophthalmic Division of APAO. So that's a great position you're holding. I would want you to speak about your experience so far.
I just need to clarify that I'm the secretary for the APAO Women Ophthalmology Standing Committee, the secretary to that. So I just want to say I'm really glad to be here, and I think it's a great joint venture, this session between WOW and also the Women Ophthalmologists of India. I think I'm learning all the time from you guys. So I shall be brief because I think we have many speakers, so I'll let you move on to the next speaker.
All right, so do we have Jimmy Mittal? Dr. Mohita would join in a little later, and Dr. Ellie also said she'll be in the other session and joining us a little while later. Then Dr. Femida is not with us. Shweta, can we have your presentation? Shweta is very dynamic young WAS ophthalmologist. She's the Madhya Pradesh Scientific Committee secretary, and also she got an award yesterday for being one of the best state ophthalmic societies. Let's hear Shweta talk about surgical innovations. She's WAS's state head of MP, of course, and always geared up to get residents and a whole lot of women in our forums. Shweta on surgical innovations. Move. Okay.
Good morning, everyone. I'm thankful to WOW and WAS for giving me this opportunity to present on surgical innovations. So why surgical innovations in ophthalmology matters? To improve patient outcomes. We all see in this conference also, we have seen that multiple new innovative technologies are coming up. In cataract, Flex has come, robotic assistance, and advanced IOLs for better visual rehabilitation of the patients. To enhance the safety and faster recovery. In glaucoma, we see that minimally invasive techniques have come up, sutureless procedures have come, the glued IOL, and multiple techniques are coming up. They are expanding treatment frontiers. In cornea and cornea, DEMEC, DESEC, and CARES have come, and SLET is another procedure that has recently come up. To increase the accessibility and affordability, low-cost cataract surgeries like the manual small incision cataract surgery, it has been upgraded to customized small incision cataract surgery, giving benefit to the patient. Now, innovations in ophthalmology are coming from India many times, and the word that has come up is innovation. Innovations in India is innovation. Human creativity is natural, infinitely renewable resource, and it's coming up with the smart, cheap solutions to people's biggest problems. We all see jugards in our day-to-day lives, and these all things make us think how we can innovate ourselves in ophthalmology. So we need to try to keep things simple, and we need to include the margin and follow your heart. So I am going to present my 3 innovative techniques which are the result of adversity. And my first innovation was on sutureless glueless SFIL. Give me the control, please. Give me the control. So when we were switching from sutured SFIL to sutureless technique, we had multiple difficulties in getting glue in our hospital, and many times the MST forceps was not available. And then we thought of thinking simple, and we found that the inner diameter of a 26 gauge needle is sufficient to allow the entry of the haptic of a 3-piece IOL. So you can see in this technique, a 26 gauge needle is used to extravasate the haptic of a 3-piece IOL, and then with an intrascleral tunnel, which is made with a 26 gauge needle itself, the haptic is tucked into the sclera. So you can see, also notice over here, there is no assistant who is helping me in this surgery. Single-handedly, we can do it. Similarly, on the other side, a 26 gauge needle is taken and then brought out to the scleral tunnel. And then when the haptic is on the sclera, and another intrascleral tunnel is made with a 26 gauge needle, the haptic is railroad into the bore of the needle. And as you withdraw the needle, the haptic is tucked intrasclerally. So there is no need for any suture, no forceps, no glue. And since everything is being done extraocularly, there is minimal intraocular inflammation day 1 post-op. And there is extremely good centration for the patient. Now, many times, recently we didn't have our cassettes. Our Laureate machine, we were not getting the phaco cassettes, and our patients wanted earlier rehabilitation and a astigmatic-free surgery. And then we thought of shifting from normal SICS surgery to a topical MICS through a very small incision. So over here, you can see that the surgery is being done under topical. And after staining the anterior capsule with trypan blue, and completing the rhexis with a 26 gauge capsulotome, a tunnel of 3 millimeter was made, the SICS tunnel. Since it is small and coming in the astigmatic funnel, so it was astigmatic free. So with these simple innovations, you can definitely give better outcomes to the patient even in times when your machine is not working. So you must be well versed with each of the techniques, and whenever any difficulty comes out, you are able to give a good output to your patient. So everything has been done through a small incision and under topical anesthesia. Now, my another innovation is on suturing the amniotic membrane graft. We all are using purse string suture, but we have realized after day 1 or 2, the sutures become loose and the amniotic membrane is gone. So we came up with a new technique of modified purse string suture, in which once we take a bite, another bite is taken just behind the first bite, and the suture is looped against the needle. And you can see that these loops are coming. Over here, you can again visualize that loops are coming like this, like just like a chain stitch that is used for in the household by our mothers. And once we come to the end, the needle is taken off and the loops are unlooped. So now all the loops are unlooped, and when you will pull this suture, the entire suture goes underneath the amniotic membrane graft. And you can see in the end how snugly the amniotic membrane is fitting onto the cornea, just like as it is with the glue. And all these things have come to my mind because glue was not available when we were planning to do the surgery. See how snugly it is fitting, and the post-operative discomfort to the patient is minimum, and our outcome is excellent. So future-proofing our ophthalmology surgery, some practical innovations that can come up and we must all try are next generation suturing and wound closure with bioabsorbable nano sutures, spray-on bioadhesives, affordable and portable surgical setups like mobile cataract surgery units, low-cost intraocular lenses and corneal implants, hydrogel-based adjustable IOLs, 3D printed corneal lenticules, minimally invasive implants with drug elocution, and smart surgical visualization and training, and AI-based decision support softwares. To conclude, innovation is seeing what everybody has seen and thinking what nobody has thought. Thank you so much.
Shweta, beautifully you've shown your innovations, and I would say they're really innovations because they're very one-off. And I do not think so anybody has tried that, not like a purse string, but very much like a chain stitch suture. And I think you should just take it up to make it more popular,
Yes.
because it's very, very interesting. Glue
Thank-
is expensive also, so it's very economical, and it is going to have uses even in pterygium surgery, I feel.
For pterygium, we don't use any suture and we don't use glue. It just sticks with the
Yeah, you
blood
can
itself. We
bear
are not
sclera
using
technique,
anything for
right.
that.
Yeah, yes. But in some bigger ones, you can still have this
Yes.
used. Great.
Thank you so much.
Thanks.
Ellie has come.
Ellie. So we have Ellie with us, and Ellie is all the way from Nepal. And when I'm going to talk about Ellie, Ellie has been a lot of, we heard a lot about her ways in Nepal and with surgery and with EPAO. She's the standing committee member as well. Her talk is going to be on mentoring to pull up my fellow colleagues. I want to talk about Ellie a little bit more as she puts her presentation. Ellie, should we hear your presentation?
Yeah,
And talk a little bit about yourself as well.
Sure. Yeah, definitely. Oh,
Yeah.
shall I start?
Yeah.
Okay. Yeah, I'm sorry because I was in another IROP meeting, and that's why I requested Dr. Aarti to keep my presentation at the end. So it's the power of mentoring, especially to pull up our fellows, colleague. So there's no conflict of interest and no financial disclosure. This is my place of work. So what is a mentor? Mentor is someone who gives us help and advice over a period of a time, especially for our job or a career. It can be a teacher, he or she can be a teacher or a guide. He or she can be of any age, in any field. So we shouldn't be thinking in traditional terms. Mentoring is important because it can have an individual's impact on our life, on mentor and mentee's life, and also, of course, on life. So if you want something, let's dream, dare, and do it. If you want something extraordinary, dream, dare, and do it with great mentors, then you'll definitely succeed. So why is mentoring powerful? Mentors kickstart our professional development. With the support of the mentor, mentees can stay focused on their careers, they gain confidence, attain goals, and expand their networks. So that also leads to self-discovery and helps us continue to grow our career. So what is the value of mentoring for our fellow colleagues? everyone needs a mentor in their career. It can be one, it can be many mentors. Just like we need a group of friends to guide us through our life. Similarly, for our career, for our life, we also need mentor. So we may be the star of our own show, but then we still need an outstanding supporting person in order to bring our vision to reality, to life. Finding a mentor, it is an effective way to tune our goals. So whatever I'm in now, so these are all my mentors. As you can see, our madam is there, and both male and female. They have been mentors since my childhood, and still I find mentors whenever I talk to people around. So what is the purpose of mentoring? It facilitates the personal and professional growth of individuals by providing guidance, support, knowledge, transfer from experienced mentors to mentee. That offers the opportunity for human connection for the purpose of learning, building new skills, creating empathetic relationships with colleagues and also with the patient or with family. That also mentoring gives us proper guidance and supporting development. With their support, we can reach our full potential, also unlocks productivity, creativity, and impactful returns for the business. So what is the difference between role model and mentors? Although the two looks quite similar interchangeably, there are distinct differences and similarities. Of course, I prefer Michelle Obama but she is my not as a mentor, as a role model, because she is a celebrity. So express definition of a mentor is someone usually known to other person with experience, knowledge, who guides and teaches that person face to face or physically. So what is the importance of mentoring young female or women or our young colleague? When we support the growth and empowerment of a woman, we raise the quality of their life and also of family and ours. They can lead business, not in a business as a money-wise, but then they can lead their profession, they lead their community, they can fight for the children, they give voice to issues that are important to our collective future, and of course education and health care. So for us, even we had difficulties for career confusion, disparity of workplace, balancing work and life. So stress of exams, sickness, conflict at work. So we've gone all through this different phases, and of course my mentors from early childhood that's helped us to reach what I am today. So what are the traits of good mentor? Motivate, inspire, leadership, help, improve, training, work. So success. These are interchangeable, and all the mentors should have this quality. How can we be a good mentors to our young colleague? We build a good foundation within our relationship with our mentee. We need to foster respect and build trust. Be always supportive and encouraging. Be both our mentees' cheerleader and support them. Set a good example in everything we do and how we handle situation. Always have a positive attitude, motivate, inspire, and whenever they come for our suggestions, advices, be positive and try to lift them up. Have morals and ethical, be tolerant and show patience, be inclusive and make them feel safe to be who they are around you. Communicate effectively, especially communication is very, very important. Be ourselves. We don't need to be different person. And mentees relate with their mentors who are real. And they're looking at us every day. The way we, communicate, the way our accents, so they are observing us and how we deal with our failures as well. So we shouldn't be afraid to fail and always, So one day of mentoring can change a life. So let's try to be that mentor to our young colleague. A good mentor offers directions and driving tips from the back seat, but you still have to drive the car. And thank you.
Very well said, Ali. And yesterday we had the showcase of the importance of mentoring in the panel discussion we had, and how we can really help uplift other women. So this just adds on more to it. And Dr. Timbu, you, Madam Awa, and a whole lot of us, Dr. Mohita, of course, has put the ball rolling for all of us to stand tall as mentors and also keep learning on the way and be very compassionate and empathetic towards all the times of need for women as our juniors and thereafter. So thanks for your talk.
Thank you.
Now we have
Carmen can call next speaker. Mohita, yes. You call Mohita and Mohita.
So I'm very glad that Dr. Mahita Sham has joined us. So please come onto the stage, and maybe we look forward to your talk and about getting them all together on one platform, the keynote address.
Only half an hour.
So good afternoon, everybody. Respected Madam, Aba Ma'am, sorry for being a little late. Carmen, Claire, Aarti, and everybody who's sitting here. So nice to see all of you together. And my topic is the same, getting them all together. And it's a wonderful experience to be part of any women's organization. And Madam, we like the podium also here because this is something which elevates our height. Otherwise, as women, we most of the times get hidden behind our laptop. So now our face is visible at least, and we are able to connect to to our audience also. So I'll be talking about Women Ophthalmologists Society of India. This is a society which started in 2015. This was the first meeting, and as they say, all big things start small. It was a small meeting conceived by 5 women, and there were 20 members who decided, let's all become members today, and let's start this Women Ophthalmologists Society. We also didn't know that it will become so big when we started, because it was taken up so well all over the country. In fact, as I always share, that a lot of time I keep getting awards which are actually awards for women, and I take it on their behalf. And one day somebody was announcing, and that person said that we are giving her an award because she started something which we also didn't know would become so big, and we never thought it will become big at all. And that was a man who was anti any women's organization when we started, but he said that but today this organization has taken over the whole country like a tsunami, and thus all women deserve this award. So now today we are 3,000 plus members, 22 state chapters in India, and we have had 8 annual conferences, and we do around 25 to 30 activities throughout the year. And these are not just CMEs and activities, but they are also in the form of various projects which help women ophthalmologists as per what their need is. So WOS is the Indian Society, and it is all about being different. And it works on the concept of givers gain, which means this concept is very, very deeply ingrained in every member of WOS, that the more we give, the more we get back. And you would not see this kind of an environment in any other non-women society. And we've seen this is the kind of environment we see in all women's organizations anywhere in the world. So all our activities are based on the concept of mentor-mentee program, which says that you are not alone in your professional journey. And this was the first survey that we did to find out what women ophthalmologists need from a society like WOS. And these are the top 3 things that they told us. One was skill enhancement, second was help in private practices, and the third was visibility in various national and international conferences. So that's when WOS started working on this, and this was the first mentorship program. We had 26 mentors, and they were men as well as women. And thereafter, there were a lot of speaker opportunities. And these are just photographs I'm going through, because these kind of activities are happening all over the country throughout the year. And there are a lot of first times, like first time ever, there was a mentored live surgery where the juniors were performing surgery and the seniors were mentoring them. So even the live surgery was mentored. And in fact, this is what I've always shared, that whenever there are live surgeries which happen commonly in all Indian conferences, and we still find that if there are 20 men operating, 19 are men and only one may be a woman. And we've always tried to encourage live surgeries and WAS so that more women come up. And as they say that 50% of ophthalmologists today are women. So that's why we keep wondering in such sessions why they are not coming forward. Is it that the industry is not promoting them? Is it that is something that is stopping them themselves? But yes, the numbers are improving and we are seeing the changes happening. And we have these Shark Tank-like sessions where we encourage our members to present newer ideas. Anybody who gets an international award, we have their sessions where they come and present their whatever for what they have been awarded. We have post-graduation sessions where we make them present. So it is all about building confidence, and all these activities have mostly first and second time presenters majorly, and at least more than 50% of the program is of first and second time presenters, so that they build their confidence and they start attending conferences, enhancing skills, and start networking. So this was our annual conference in Varanasi. We thank our madam who made all the efforts to come there, and it became a memorable conference because of you, madam. And this was in 2024 in Delhi. And this, what I'm trying to show in these slides is that whatever sessions happen, they are very different from whatever you would normally see. There are a lot of them which are based on industry partnership. There are a lot of them which are based on enhancing surgical skills. A lot of them which are on various inspirational women, and they come and share their journeys. So that's how it is all formulated. Now, what we are doing currently is that at our state chapter level, we are doing WAS state chapter meets, and every year we will come out with certain requirements that women want. So our state chapter meets this year are focusing on skill enhancement, on quality, any aspect, with a special focus on infection control and on workplace challenges. And these state chapter meets we are doing this year. Till now we have done in bigger cities and metros, but we are doing in 2-tier and 3-tier cities also, so that everyone gets an opportunities. These are some of the examples: one meeting in Jabalpur, one meeting in Pune, and henceforth. Resident programs are also continuing this year. We have this project Archana, which is to deal with newer challenges of dissatisfied patients, angry patients, violent patients, and mobs. This is being looked after by a team led by Dr. Anjali Mehta from Delhi. And because these are a new subset of patients which we are all coming across, and this doesn't become a part of our curriculum. We have a project Shakti, which is being led by Dr. Jimmy Mittal from Lucknow, and this is to deal with workplace challenges, because we believe that unless and until we take care of our workplace challenges, there may be a small challenge, there may be a bigger challenge, unless and until we team up with our colleagues, we cannot perform better. Then there is a Women in Research or WINAR group which is working, and for this we have our own WAS Ethics Committee. We have this website. We have this website enumerates the special calls for women researchers. We have these closed door meetings and Shark Tank-like sessions. These were our initial 5 completed studies, and now there are more. We are working on the rare eye disease group, and for this we got support from Maria, and that's how we discussed with her. And now that we are into creating registries, we'll take more support from her. So we started a pilot with where there are registries on 10 rare eye diseases. On genetics, we felt, again, Maria, I would like to introduce you to this, that we felt that clinicians are not into genetics, and they always felt this is not for me. So we have created a new genetics brigade of 30 women in the last conference, where there are clinicians who are incorporating genetics into their practice, and they will be teaching more to get into it, so that we are able to make genetics as a part of our practices also. And we have this webinar wing also has this very interesting think tank sessions, which are like Shark Tank, and we had one 3 days back, where 15 new ideas were presented, and they were presented to an expert panel. In this, we make it a bridge between the industry, between the clinicians and the researchers. So when the idea is presented, the industry is also present, and whichever ideas they like, they select and take it for due diligence and to make it clinically translational and go through clinical trials, etc. So then there is an entrepreneur wings, which was launched last year under the leadership of Dr. Samina Zamindar, another very strong core member of WAS. And in this, we are doing intraocular lens project, which is a Make in India project with 21 of our investigators. And we'll be setting up 5 dry eye clinics, 10 model contact lens clinics, and quality initiatives. So these, the idea of these model things is that our initial few members do this, learn how it is to be set up in the best possible manner with industry support, with WAS support, and then they teach it to others. And there's a lot of excitement about that. Just sharing how we went to Chennai to start this project. Thank you, Suguneshwari, for making this happen. Is she here? She must be somewhere. Yeah, we visited the factory of Appaswamy Associates, which is one of the largest factories here. And we saw how all the things are manufactured, and we were very intrigued by what was happening and how much quality control, how much good work is happening. And hence, from each state level, we have 22 state chapters, women enrolled to get into this project, where they are based on a common protocol. They are all implanting lenses, and it's a 2-month study where you can see how nicely they share all their photographs of what they have been doing. So this is a kind of a thing which builds up the whole atmosphere, and they will all collate their data, they will share their data, and they will become the new KOLs for the company. Because we felt that when we saw literature, we found that women had less ties with the industry compared to men. So we thought this is a way in which our women would have ties with the industry, as well as if they like the results, they will promote it further. So similarly, 10 model eye clinics with Bausch & Lomb, where there was a training session, and then virtual training session, and after that physical training sessions at 10 places from some of our members and from all over India. And they are now they keep sharing their photographs, how they are setting up those model contact lens clinics. And once they have their success stories, they will share it with others and set up more. So that is kind of getting them into the commercials also, which is important because our branch is very finance intensive. And this is the WAS Care program. Dear Shweta is sitting here. She's, last 2 years, she's been trying to work on it because it's a difficult program, but now she has finally formulated the guidelines, and she has been able to manage to get some institutes enrolled and for providing short-term trainings and fellowships for our members. And she has managed to get some sponsors also. So we are expecting it to launch it soon. And this is basic idea is that there will be short-term trainings and fellowships, so that because women find it many times difficult to go for long-term fellowships. And finally, before we end, I will just talk in brief about Women Ophthalmologists Worldwide. This was an association which was started in 2020. This was the first annual conference. Again, our madam is always our most special person in any women's related conference. And madam, this time we will take your promise prior only for this year. and then this is about the WOW Nepal chapter. This organization is is a worldwide organization, so that we have connections between the countries also. And for this, we would be we are soon planning to partner with women leaders in eye health. Claire is already there from Orbis, and this is the Nepal chapter launch. With Dr. Ellie's effort. This was the Sri Lanka chapter launch with efforts from Dr. Pradeepa Sirivardhane, and this is about our last evening session of combined with Orbis Women Leaders Eye Health. So these are activities which should not be missed, because everywhere you go and learn something new and you connect with new mentors, and if not mentors, new friends who are ready to support you in every manner. So that is what WAS is all about. The last slide about Mother Teresa, my favorite slide. I alone cannot change the world, but I can cast a stone across the waters to create many ripples. So all these women here in WAS have actually cast all those stones, and that's how we became a tsunami. Thank you.
Yeah. So I would just say we are all here because of all this effort made by Dr. Mohita and Abba Ma'am's always encouragement, and also of the fact that now we have a WAS and now WOW session in international and national conferences. I think that's a great feat we've achieved. So, and we do make sense, and we can talk tall on that. Dr. Karen, you can call upon Dr. Anne.
Yep, okay, so we have a slight change of the order of the speakers, because we have a next event coming up at lunchtime, which I'll tell you a little bit more about. So we're really honored to have Dr. Anna Tan with us today. She's a senior consultant at the Singapore National Eye Center and a clinical associate professor at the Duke NUS. She is very well published with 100 peer-reviewed articles, editorials, and book chapters, and she has many awards, including the Macular Society Travel Grant, Distinguished Service Awards, and the ARVO Emerging Advocate Award. And her main interests are in age-related macular degeneration, ocular imaging, low vision, visual rehabilitation, digital technology, and global ophthalmology. But she's going to talk to us a bit about something a little bit different today. She's going to talk about gratitude and give back to the community. So thank you, Dr. Tan.
Hello. Thank you for having me, and I'm just so inspired today by Mohita's talk and Ellie's talk, and about what the great work in women in ophthalmology is going around the world. I think personally, the Singapore Society of Ophthalmology, we formed our women's chapter only this year, so we're a bit slower to the uptake, and it's very inspiring to see in the established chapters around the world what activities are going on, and we can really inspire ourselves to reach a more active state. My talk today is gratitude and give back to the community. So this picture that I have here, it's just a picture I put into AI when I put this sentence into the AI model to see what it comes up with. And it really gives you an idea, that giving back to the community can take many, many forms. So we really, as ophthalmologists, shouldn't restrict ourselves to only thinking it's only in one way, but we really should look at it in a really holistic perspective. I think one of some quotes that Helen Keller, who is a very famous advocate, is, these quotes that I've put up of her is especially special because not only is she born on my birthday, she's also born 100 years before me, so now you know my age. But this really speaks to me because dealing with a lot of disability and visual rehabilitation, Helen Keller was born both. She wasn't born deaf and blind, but she acquired a disease that made her both deaf and blind. And through her adversity, she really managed to become a great voice, a writer, and an advocate, and not just for disability alone, but also in terms of civil rights, in terms of being a woman suffragette, where she was advocating for women voting, and she also did a lot for the disadvantaged communities and things like that. And this is really an inspiration that despite being having a significant disability, she was able to really achieve so much. And this, for me, was a very great inspiration. So, these quotes that I put up here that you can read yourself really give us a few principles. I think, when we look at the gratitude and the definition of gratitude, we want to look at the quality of being thankful. And this thankfulness and appreciation, we want to return the kindness. And in a way, we can summarize it as paying it forward. But this attitude of gratitude, I feel, is not just enough. It is what puts a spark to a fire, but in order for us to have the fire of want to give it back, we need to ask ourselves why we want to give back to the community and what fuels us to want to give back to the community. So I'm going to go through a bit of my own personal journey of why I wanted to give back, what we can do to give back, and how can I start giving back. So, in a way, when we ask ourselves, why do we want to give back to the community? I think, we want to, as women, be representation and inspiration for the next generation. This is Professor Kyoko Ono Matsui, and I had a privilege to interview her in one of our young ophthalmology initiatives for APVRS, and to ask her why and what inspired her to do ophthalmology. And I think it was really fantastic, and her words was just that she just thought ophthalmology was such a beautiful specialty with all the photos. You could look in the eye, and it just looked in a very aesthetically pleasing sense. And I just thought that was a really nice way to look at ophthalmology. And so I think every one of us, as we grow in our careers, have the responsibility to be that role model and that representation. And for those of us that are privileged enough to be on a more global and regional stage, I think this really can show people that it is possible to have a seat at the table, even as a woman or even as an Asian woman. And I think that is a true reason of why we want to give back to the community. I think empowerment through service. I will tell you a little bit more, but this is just a picture of me when I was a medical student fixing microscopes in the rural Philippines. This has always taught me that, by doing service in other places, we really do give our power back to communities to continue the work. And I think empathy and connection is what we all crave, and that's the reason why we do a lot to give back to the community, and of course, creating positive change. So how have I been doing that? I think I started always wanting to do a lot of this work, even as a medical student. And I increasingly, when I became an ophthalmologist, I was wondering which area in the Singapore National Eye Centre, which specialty I wanted to do. And I really always felt there was a great need to advocate for the visually impaired. As ophthalmologists, sometimes we neglect visual rehabilitation because it's not a very sexy money-making field, but it's very important. And when I chose my subspecialty interest, I chose it because I wanted to make more impact in the visually impaired world, and hence why I'm a medical retina doctor. And I think through the journey I had building a team of multidisciplinary people like low vision optometrists, occupational therapists, and social workers, we went together to train. And us as like-minded individuals, you can see in the photo in the middle there, we really managed to bring together a lot of initiatives, which included, giving digital technology training for the visually impaired. We incorporated a lot of sports like Paralympic swimming, and we are like the main classifiers for all the para sports in Singapore for the visually impaired. And as a result, we also get our staff to go and support a lot of the international events. I've also been privileged to be the Vice President of the Blind Association in Singapore, and this is one of my good friends, and we were on the news and Channel News Asia, and we were both talking about how visual impairment should not stop you from participating in sports, and we've become many good friends over the years. And so even locally, it was very inspiring that we were able to do so much, and we also were able to see in the second one find communities in Singapore that were very underprivileged privilege. Even though Singapore is nice and shiny and you come there and you see all our nice tourist attractions, we do have pockets of society that also need help. And I think that taught us a lot on the barriers of healthcare delivery even within Singapore. And of course, serving in local societies, as I mentioned, the women's chapter is started. I also am the treasurer of the Singapore Society of Ophthalmology, and I think this is a really good way to be active locally and to give back to the community there. As my career grew, I was able to give back more regionally. So I started teaching and I started being involved in a lot more Asia Pacific conferences and also in societies. I also became the director of Global Eye Health, and we started doing a lot of outreach work in other countries, which included Laos and in Myanmar. I think the most inspirational thing is my journey started when I was a medical student. I told you I went to the south of Philippines to fix ophthalmic microscopes, and you can see the first article that I wrote on the right up there is really the article that got me into ophthalmology. So and then through my career, I think training international fellows, them going back to see how their career have progressed, has really been my inspiration to keep doing this. I think in Nepal, we had a great collaborative meeting there, and I'm very happy to report that my fellow, who's my Burmese fellow, has just completed her APAO LDP project in implementing AI for diabetic retinopathy screening in Myanmar. So regionally, also, there are many opportunities, and I think as you become more influential, this is the way you can give back. And of course, globally, being a panelist, being a speaker in the global stage, and also even influencing things like we became a WHO collaborating center and going to WHO meetings, and now even influencing policy and policymakers. This is a very exciting way to give back globally. So I will just end with some ways you can start to give back. Of course, you have to be authentic, know your strengths, and challenge yourself. I always think the team is what makes this most special, finding like-minded people to form lasting connections. I work very closely with a lot of young women ophthalmologists, and we really are quite passionate about our work in the region. And also read widely, think out of the box, and seek new experiences. Work hard, persevere, but also play hard and be mindful of impact and sustainability in all the programs. So with that, I thank you very much for giving me this opportunity to share, and I hope it's been helpful. Thank you very much.
Thank you so much, Dr. Tan. And if Dr. Tan will also be giving another talk at the Women Ophthalmology Lunch, which will be held in about 6 minutes in the Junior Cafe on second floor. Lunch is included. So proper sit-down lunch. So please encourage all your colleagues to come along. Second floor, Junior Cafe. Okay. So maybe I'll pass the mic.
Okay. I guess Dr.
Then we can't.
Raba Malar is not with
Only
us.
5 minutes.
I'll take up her topic.
Only 5 minutes.
Networking to find new opportunities.
Are they? Just a minute. My apology, as because only 5 minutes left from here, I would go to the Juhi Cafe for our luncheon. Claire, you will come, and everybody should come. Just I will say 2 minutes. There is another session that is also women session, and that is the APO session. And this one is the Women Ophthalmologists Worldwide and Women Ophthalmologists Society of India. You have heard about AIOS, who are the Indian personality. You know better AIOS than me, but I also know, as because every time Mohita invite me and I was there. Only 1 or 2 I miss it. Otherwise, I always try to come, as because she is telling in such a way that there is no way to say no. I have to come. So, but about women ophthalmologists worldwide, this is very new, but here we are sorry that Femida Kerani is supposed to come here. Some visa issue is there. Ultimately, she could not come. And she is the president of WOW, and Dr. Mohita Sharma is the secretary, general secretary. So in this way we are running, and Claire is also there, and other from Bangladesh, Dr. Jolly is here, and you are all, Shati Tomar is there. So everybody, I'm just very close attachment, but I didn't mention her name, Dr. Carmen Chan. She is very active and very meticulously do her duty in all the way. So this is a very nice session, that is Mohita and her all team. They have make it in such a way that empower, evolve and excel. We have complete the empowerment. Mohita, Claire and Eli Pradhan has speak on that, and evolve surgical innovation very nicely Shweta Walia has mentioned, and the Anna Tan also about the gratitude and feedback, give back to community. So I think now is the Pearl in ophthalmology Excel group. I should take leave. I'm really so sorry that I could not stay, as because that is our, Carmen is the secretary of our APO Women in Ophthalmology. And that is the luncheon, and there will be 2 speakers and a panel group that will be also, and so many guests from APO, they will come. So we should go now. It is almost the time. Sorry, I should go. Please forgive me. Thank you so much. Yes,
Yeah.
please.
Yes, please.
Everybody should come.
Yeah, so when you finish, please
After
come along.
finishing, yeah.
Yeah,
Juhi Cafe.
Jury Cafe, yep. So
This is second floor.
second floor, yep.
Second floor.
It will be well, there'll be 2 talks, and then there will be informal discussion, so it will be a nice time to
Right.
chat over lunch. So see you soon. So,
Jolly? Yes, sure.
So I would like to introduce Dr. Oh, no, I'm sorry. Yeah, come on up, Dr.
Clear?